Assalamu alaikum and very good evening, everybody. I'm your host, Saima Asghar, Director, ISA Pakistan chapter. I'm also serving at M. Jinnah Foundation and New Life Rehab Center, Sialkot. Right now, I'm coming to you live from ISA Pakistan chapter and Youth Forum Pakistan's Facebook pages and YouTube channels, and welcome you all in today's live session on aftercare services and its challenges. You can also watch us from ISA Pakistan chapter official group, Facebook group, and you can also join from ISA Pakistan and Youth Forum Pakistan's Twitter. As usual, before we start our live session, I would like to share a brief introduction of ISA Pakistan chapter. As many of you know that ISA Pakistan is an international membership organization which really focuses on the development, support, and representation of professional working workforce for substance use prevention, treatment, and recovery field as well. Currently, it has estimated 20,000 members around the world, and 24 national chapters has been established under the umbrella of ISAP Global. ISAP Pakistan chapter is one of those. I would also like to share that ISAP Pakistan chapter is also a approved training provider by Colombo Plan Drug Advisory Program. Uh, I would like to share that because of COVID-19, it is very much difficult to conduct face-to-face sessions. So that's why as a Pakistan chapter and Youth Forum Pakistan take initiative to start live sessions by inviting international experts who are having huge experience in substance use treatment and prevention field. And now it's time to introduce our very special and honorable speaker guest. Many of you knows that, and he is also a very well-known personality across the world, Mr. Iqbal Masood from Bangladesh. He is an international certified addiction professional. He is a director, health sector, Dhaka Ehsania Mission, and he is also a global master trainer by Colombo Plan Drug Advisory Program. He is a member of National Anti-Drug Committee, Ministry of Home Affairs, Government of Bangladesh. He is also an international certified addiction professional. And welcome you, Sir Iqbal Masood, in today's live session. Assalamu alaikum, sir.
Thank you, Saima. Assalamu alaikum to you and our viewers. Assalamu alaikum and good evening. Thank you very much for inviting me.
Thank you very much, sir. And on behalf of all ISAP Pakistan chapter and ISAP and from all the Pakistan, I would like to welcome you and thank you very much for your precious time to join us on a very important topic. Today, we are going to share and discuss aftercare services and its challenges. And I would also like to share that these aftercare services belongs to the substance use treatment. It is very important to know that what type of aftercare services should be provided to the substance use disorders clients who are taking successfully treatment and what services should be provided to them. So I would request Sir Iqbal Masood to share that what is aftercare and why it is critical for recovery process.
Thank you. This is a very good question for the drug treatment professionals because for the present perspective, it's very important. So before going to aftercare service, I want to explain a little bit about the drug addiction and treatment services. Million of people struggling with the drug abuse and addiction, although it's a common to devastating disorder. Addiction is a chronic illness similar to diabetes and also arthritis and heart diseases. And drug addiction is a treatable disease, but not a curable. And drug addiction is a manageable disease, but not a curable. This two term is very important. It's a manageable and treatable, and high rate of relapse. And this condition, like substance use, are lifelong process, and cure is very difficult. Normally, we do not use the word cure, and very efficiently the patient can manage effectively and treat with the therapies, counseling, and medically assisted detoxification and other education and others approaches. So, drug is addiction is not a easy matter. Before going to, I explain a little bit, because you have to know the nature of the addiction and treatment process. Now I'm coming to aftercare. What is aftercare? Aftercare is for the nursing period for achieving sobriety, and is a maintain the abstinence, and also the through abstinence the achieve the sobriety. And primary goal of aftercare is to help the clients develop and achieve the coping skill as you face the challenges in sober life. And aftercare service can help the clients to maintain the sober life and reintegrated the society and reintegrated with the family members as a normal life. And aftercare service also make healthy choice about the lifestyle, achieve the good relationship with the family members, and reinforce the life skills, coping skills, stress management, and a strong emotion management. This type of problem through we can achieve through the aftercare services. But main goal is maintain sobriety and abstinence. And you know that in our Asian country we have no enough study, but in America, USA, there is a overall population 10% population is suffering with the substance use disorder, and after the treatment, relapse rate is very high. At least 60% drug substance users they relapsed, and the benefits of the aftercare, those receive the aftercare services, the relapse rate is less than those are not taking the aftercare services. So this is the aftercare services, and very brief and very basic things. Thank you, Samia.
Thank you very much, Sir Iqbal Masood, for sharing the aftercare services. Very brief, but very to the point as well. So I would also like to welcome our viewers who joined us recently, and I would also like to share that we have a very experienced guest speaker with us, Mr. Iqbal Masood from Bangladesh. So we are talking about aftercare services and its challenges. And please remember that we are talking about the aftercare services belongs to substance use treatment. And now I would like to request Sir Iqbal Masood. Sir, would you please tell us about the relapse factor and how to prevent relapse? How to prevent relapse? Yes.
Relapse is a common issue because I told earlier, substance use disorder is a chronic and relapsing disease. So relapsing is a very common and is happen. No one can avoid the relapse. Some people not avoid the relapse, but is a depend on the individual factors. It's client factors. You can say for the everyone relapse these regions. No, it's an individualized issue, and individually the problem they face and they relapse. Last year we conducted a national level research in Bangladesh. Our organization conducted with 139 drug treatment center, 27 district, and sample size was 997 relapse patient. All are relapse. We try to identify why the people are frequently relapse and the major causes of relapse. I am sharing our experiences, but I think our subcontinent, Pakistan, India, and other country, Bangladesh, almost similar. The difference is very little. So we found in the research, there is some other component in the research, but we found the family unrest was the most common. 29.5% cause, relapse cause was family unrest, family conflict. And second was peer pressure. The friends influenced them to take again drugs, 27%. And third one, the depression. They feel very embraced and depressed. When they depressed, not feel good, they go back to the drugs. And other major factors was craving, not managing, well-managed craving, and willingness to take drugs. Some people enjoy the drugs-taking behavior. Some patients feel good when they take drugs because especially for the amphetamine user, yaba, we called yaba. I don't know about the Pakistan, but in local name it is a yaba, is the amphetamine type drugs. That sometimes the patient feel good and feel comfort and enjoy sometimes, and they feel they don't feel the problems. So the willingness to go back with the drugs is 22%, and some told the tension, reduce the tension, stress, they go back to the major causes we found relapse cases that, but there is some other underlying causes, some other factors. But I think in our experience, this is the main factors. But I don't know exactly about the Pakistan and India. But I think that this is the major cases in Bangladesh, causes in Bangladesh.
Thank you, sir, for sharing your experience from Bangladesh. And today we also, it is very, the main objective of ISA Pakistan chapter and Youth Forum Pakistan to invite experts from the other countries. So that's why they can share their experience. And we are by sitting our homes can learn from you kind of experts by sharing by learning from your experience. So today we are talking about the aftercare services. So we also talked about the recovery process and how to prevent from relapse. So I would also like to refer my a question once again with aftercare services. Can you please share that what types of aftercare services are available, especially in our region? Or from, you can also share your experience from Bangladesh as well.
Okay.
Yeah. What
Thank
types of
you.
aftercare services? Yeah.
Okay, thank you, Saima. You can speak in Urdu. I completely understand Hindi and Urdu, but I can't speak fluently. Sometimes thoda sa I bol sakta hai, na, but I understand
Wow,
Urdu.
that's very nice.
So,
That's very nice
so
to hear.
your viewers are almost Pakistani, and if they feel comfort, you can speak with me in Urdu. But I understand completely Urdu and Hindi, but I can't fluently. I can't speak. So I understand.
Oh yes, we can understand because we are not used to speak. Even we have 4 or 5 provinces in Pakistan. We only can speak Urdu and Punjabi as I am a Punjabi, so I can only speak 2 languages. But we appreciate that you can also understand other language as well. Thank you very much, sir.
Okay, thank you.
Yeah.
Uh,
So we are talking
thank you.
about what types of programs
Yes,
are.
what types of aftercare program we normally follow?
Yes.
In normally, aftercare program can give patients access to follow the resources which can help them live and drug-free life and less stressful life, I earlier mentioned. But it's not a common fit for the all. It should be the client-centered. It should be the individualized program to fix individual to the suitable for them. But in normally, we follow the career counseling. We follow legal service and supported. And aftercare is I'm saying a little bit about the treatment. If we follow the treatment procedure, there is a major part of the treatment is a pre-treatment phase, treatment phase, and an aftercare phase. And Aftercare also is a part of the treatment. So, rehab center, clinics, and hospital, drug hospital can, after the release, they can invite patient to associate with them, and they can provide the service, and they invite to engage them to take services after the release. And through normally we provide career counseling and support, and legal advice and supports, long-term support through major uh, I think mental health support, case management is a continuum of care, part of the continuum of care, and substance monitoring. We call dope test. Dope test is very important for the aftercare services. If we introduce the dope test, the patient be careful about their drug taking behavior and relapse and lapse. So dope test also a very important component and services for aftercare services, and coaching and goal setting, and community engagement, community trust building, academic support. Those people dropped from the education institute, we can refer them to education institute. We can link them to education institute, and financial planning and budget support is also important for South Asian country, because poverty is a major issue for using the drugs we called, and if we provide the financial rehabilitation, they can get the jobs and business. So financial planning and budget issue also help to prepare budget and technical support, and other is a family involvement, because after release the patient almost they stay in the home and with the parents, so need to prepare parents to deal with the clients. If parents fail to deal with the clients, the relapse can be higher. Earlier I mentioned the family unrest, family unsupportive, they don't support with the recovery. That's why family engagement is very important, and family program also need to and another issue is a community support building, due to reduce social stigma, and rehabilitation, reintegration, social network, and community engagement is very important. I think these are the major component of the rehabilitation aftercare services.
Thank you, sir. Very well explained about the aftercare types of aftercare programs. As many of our professionals knows by getting UTC trainings and other experience to provide substance use treatment, it is very important to guide our clients during the treatment and prepare them aftercare services by guide them about career counseling, as you share with us, and financial budgeting, and refer them to provide them skills help. So that's why. And now I would like to request once again that why every patient needs to know about aftercare services. Is it important to know? Yeah.
Definitely, it's very important, because when the patient come to take our services, they should know our whole services. And when we explain our services, we should explain a little bit about the aftercare services, because I told the aftercare services is a part of the treatment services. Sometimes clients need more services beyond the regular rehabilitation services and physical treatment, mental health treatment. Then they need to nursing their coping skill, life skill, and social skill also. So if client know about our services, rehabilitation, and they know that the part of the aftercare services, the part of the treatment, they will accept us, and they will mentally prepare to receive this aftercare services after the residential services. And it can be outpatient services, and it can be inpatient services. And sometimes we use the halfway house. After the treatment, those need the reintegration with the society and family, we provide halfway house facilities, and that one also the aftercare services. So when the client know they are the we offer the aftercare services, they feel confident to maintain the abstinence.
Thank you. Thank you very much, sir. Iqbal Masood very well explained about the aftercare services. As we know, we can very clearly understand that aftercare program is also a part of treatment as well. So we are also receiving a lot of appreciation. You are very well explaining today's session, and people also requested, can you please share something in Urdu? They can understand.
I understand Urdu and Hindi. But I don't know. I speak little bit Urdu and Hindi. This mixed, but I don't know what is Urdu. What sentence Urdu and
It's like the same, not same, but very similar words from
yes,
Urdu and
yes,
Hindi. So you
yeah,
can
yes.
speak if you can, please, for our viewers. They are requesting
Uh,
us. Okay. Or can we take another question?
okay,
You can
sure.
explain if you feel easy to speak in Urdu or Hindi mix as well. So I would like to request you once again that please share with our audience that how rehab and aftercare programs can prevent relapse. Yeah.
Uh, I also mentioned in my previous question,
Yeah.
aftercare services is very important for prevent relapses and maintain the sobriety and achieve the wellness. You know the wellness. Wellness is will to it's a goal to achieve client for the sobriety, and you know the drug maintain the abstinence and sobriety. There is a two different issue. Some people feel that I am not taking drugs, but I am sober. No, they are, if they practice the bad learning, bad behavior, their antisocial behavior, they are not sober. They are not achieving the wellness. And you are right, you are drug free, but you are practicing some other bad elements. So if you want to achieve the severity, if you want to achieve wellness, and you know the those brothers receive the UTC services, there is a session in wellness. There is a will, there is a so many components for a complete life, for a good life when they used to in drug-free life before taking drugs, they have the good lives, that type of lives. So I think relapse to prevent the relapse and aftercare service is very essential, and it helps client to achieve, and not only the client's own, in the society also benefited for the aftercare services, and also is prevent the crime, is in family unrest, the prevent family unrest, the family issues resolved, and also the financial issue of the family they take care if they maintain the sobriety and drug-free life.
Yes, thank you, sir. It is very important to prevent relapse, to also guide them, family, to help them to maintain their recovery, and finance is very important. So we can also guide them to maintain their financial issues as well. So I would like to ask and request you that can you please share that what is the length of duration of aftercare services? Can we have a specific time period to provide them aftercare services, or
No,
we can just
it's
continue and yeah.
it's depend on the clients. Some people after the very short term treatment, they maintain the drug free life and they achieve the sobriety, and some people taking the long term treatment, but sometimes they relapse. Yes, depend on the person to person, it's vary. So it's a length also the vary. When counselor and other technical staff, the assessment, they conduct the assessment, whole assessment of the clients, they will fix the aftercare services length in when they identify the problems, and based on the problems, they will fix the time and durations. But normally, we told those clients and patients face mental health problem, they need long-term treatment.
I think there is a internet connection issue once again. Okay, I would like to share with our viewers that we are today with us a very experienced guest speaker with us, Mr. Iqbal Masood from Bangladesh. He's an international certified addiction professional, and he's a director, a health sector, Asania Mission, and he's also a global master trainer and member National Anti-Drug Committee, Ministry of Home Affairs, Government of Bangladesh as well. So we are talking about the aftercare services and its challenges. I would like to remind all of you once again that we are talking about the aftercare services of substance use treatment. If someone is suffer from the drug addiction, and and after the treatment, what kind of services should be provided to our clients to maintain and can more long their recovery as well. So we are facing, as you can see, we are facing internet connection issue. So we are trying to sort out this issue once again. Thank you, Mr. Shafiq Anwar Saab, for your appreciation, and Shahid Mahmood Saab for your active participation. And it is very important question received by Mr. Shahid Mahmood Sahab from Gujranwala. Thank you, Taiba, for your wonderful comments. And welcome you, sir.
I'm extremely sorry because my
It's all
broadband
right,
and
sir.
Wi-Fi
It's totally all right.
problem.
It's totally all right. Thank you, sir. Thank you.
Now I
I
am using the
was hearing your
mobile.
introduction once again, as you are very familiar already in Pakistan, and not only in Pakistan, around the world. So, I would talking about the length of services provided for aftercare services. Can you please share once again?
Would you tell me again? Uh,
As we were talking about, what is the length of duration of aftercare
okay.
services? Yes.
Uh, yes, thank you. I told it's depend on the person to person. Some people need very short-term services according to the severity of the addiction and their mental health status. When the counselors and other technical staff conduct the assessment, after the assessment, they can fix the aftercare services when they review the assessment time, when they prepare the treatment plan, and they can initially they can fix the sometimes. But in normally, we suggest in Bangladesh at least 2 years they should maintain the aftercare services, and they can engage with the centers and counselors and the sponsors, and also the NA groups. NA groups also a good aftercare service provider, and many patients maintain the sobriety through NA program, AA program, Narcotics Anonymous, and 12 Steps program. So those are the good component. So again, I'm telling that it's not a common common for the all. Some people need long term, some people need more than long term. Those are facing the mental health problem. You know, the mental health problem, those need long term nursing and long term medication services. So after the release from the centers, they need good nursing and good support from the rehab center and doctors and counselors.
Thank you, sir, for sharing in very detail about the aftercare services and its duration. I would like to share that we have almost a similar culture in Pakistan and Bangladesh, and types of treatment may be the similar provided in Pakistan and Bangladesh. And we also know today from you in a very detail to what kind of services should be provided in aftercare, and which are the more necessary to maintain their recovery as well. So I would like to request you once again that which aftercare program you think can be more effective in Asia? Can we? Yeah.
Before going to your question, I want to take a question from our viewers.
Sure,
Shahid
sir.
Mahmood. Shahid
Yes.
Bhai, Assalamu
Yes.
alaikum. Your question is very important because abstinence and sobriety is two different issues. Abstinence means drug-free, and sobriety means more than that. You have to achieve the good lifestyle, and with rehabilitation, reintegration services, prevent the antisocial behaviors. And abstinence, just you are not taking drugs, but if you have some antisocial behavioral issue, some crime issue, there is not a sobriety. So those are the sober. They maintain the good quality of life. We call the good quality of life, like other people. Thank you, Shahid Bhai. And what is your question, Sema? Sema, I can't hear you. I can't hear you. I may you mute.
Sorry.
Yes, now it's
Sorry.
okay.
Sorry. Actually, I was asking that which aftercare program is more effective in Asia? Can we
Okay.
specify one program
Yeah,
that
yeah.
is very important? Yeah.
I have seen in different countries, in Bangladesh, Pakistan, India, Sri Lanka, and other countries, the NA platform, Narcotics Anonymous platform, there's a good platform for the aftercare services. If our rehab center introduce or link them to NA group and engage with a sponsor, that helps more to prevent the relapse. I think it's a good technique. And vocational service also is a very important, and financial rehabilitation. But it is very costly in terms of our experience. In 3-4 years back, we established a vocational training center for the drug dependent patient. After treatment, they can take rehabilitation vocational training. But when we see the client demand is different than their quality and capacity. Sometimes they want to be a computer engineer. They want to take software making development course, but they have no education qualification. So it is very challenging for us to provide the vocational service according to the need. But when last part of the treatment, counselor normally prepare family and client to reintegration and rehabilitation. That time, according to their capital, we know about the capital, personal capital, family, social capital, and family capital. So we need to identify the capitals, and after the identification, we need to fix the services for him according to his education qualification, his capacity, age, and others issue. I think I address your question.
Yes, sir, exactly. Very nice and very well explained about the most effective program for aftercare in Asia as well. So I would request you once again that does having a drug recovery aftercare plan improve outcomes? It's very simple, but we have received from our audience.
Yes, definitely. In my first part of the space, I mentioned one study in America. The America overall population 10% are suffering substance use disorder. And after treatment, at least 60% patients are relapsed. It's a very high, more than the 60% sometimes. And one study in America, they conducted, those clients received aftercare services from the service provider, rehabilitation center, hospital, and other service provider. The relapse rate is very less than the those are not engaged in aftercare services. So this study we can follow this study, because in our continent and our neighboring countries, we have no enough study. So sometimes we depend on the Western country study. This is the very good study, and I think this is good for us also. If we engage them in aftercare services, then we also prevent the relapses, and parents also will be the very happy, and client relapse rate will be the reduced, and it will be the good for the rehab also.
Thank you. Thank you very much, sir. And for our viewers, I would like to share once again that we have our very experienced guest speaker with us from Bangladesh, Mr. Iqbal Masood. He is an international certified addiction professional and director, health sector, Asania Mission, Dhaka Asania Mission, Bangladesh. He is also a global master trainer, and he is also a member, National Anti-Drug Committee, Ministry of Home Affairs, Government of Bangladesh as well. So we are talking about aftercare services, and till that we learned a lot of about the aftercare services. Now I would like to request Sariq Balmasood that the other part of our topic, that what are the challenges being faced as a service provider and as a client during the aftercare program process. Sorry.
Okay. Conception of the treatment is not clear to the family members and our community people and general people. They feel the drug addiction treatment is a one-time episode like other treatment. We send our client to the rehab center. They back me a clean boy, good boy, sober boy, and they don't feel they need the nursing. They need continuum of care. They need case management and aftercare services. This is the most of the time we face these challenges. The parents' concept is not clear about the aftercare services. And another issue is the social stigma. Our society, normally when our drug department person after treatment, they go back to the society. Normally our society ignore them, teach them, and sometimes the social stigma reinforce to the relapse. So social stigma also a big issue. Due to social stigma, shame, and guilt, sometimes the parents do not want to receive the aftercare services. Also the treatment services, they want to hide. At first time, you know that you are running rehab center. So you know about more than me, I think. So when the parents come to us, they normally told, yeah, they are using the drugs 6 months, 7 months. But when our counselor conduct the assessment and screening, they found the drug taking behavior more than that, 2, 3, 5 years. Because parents at first time, they want to ignore, they want to hide, and they want to don't recognize. When the parents do not maintain and they do not bear their cost, then they come to the rehab center and clinics and other service provider. We are suffering, and normally due to social stigma, they hide their problem. Also, the social stigma is a big issue for the aftercare services. One issue we need to mention: the female client is more than vulnerable than male client, because female in Pakistan, Bangladesh is a Muslim country. So our family members, our society do not accept the drug taking behavior and drugs also, and that's why parents more hide their kids' drug taking behaviors, and they do not want to take long-term nursing, long-term services from the rehabilitation center and drug treatment center. So this is the main challenges, and another challenges is financial rehabilitation. Financial rehabilitation also important for developing country like Pakistan, Bangladesh, India, and our underdeveloped country, because so many people are unemployed, they have no job, they have no enough income issue. So financial rehabilitation is a very important for prevent relapse also.
Thank you very much, sir. You really very well guide us about aftercare services and after and its challenges as well. We are very much thankful, and we are also receiving a lot of appreciation for you in our
Thank you,
comment
thank
box
you, thank
from
you.
Pakistan and India and other
I feel
countries.
very honored. I feel very honored, Pakistan brothers and sisters. It's my pleasure to talk with you.
Thank you very much, sir. Once again, thank you very much. We are also very much happy for your precious time, as you have a very busy schedule and looking your many health projects in Bangladesh. From Dhaka Sania Mission is very famous organization around the world. So we do not want to miss the opportunity. So that's why we requested you to share your knowledge and experience with our Pakistani
Saima,
viewers. And
I want to share one information through you and viewers. My organization
yes,
Dhaka Ahsan Mission established a country office in Islamabad, and
wow,
Dhaka Ahsan Mission implemented education program in Khyber Pakhtunkhwa province, and
wow,
my boss push once a time. He told me he want to send me to Pakistan to open a rehabilitation center, because your narcotics department DZ requested my chairman. They meet in the Vienna and CND in UNODC headquarters. Your narcotics DZ narcotics control and my chairman, and your DZ narcotics control requested us to open a country. I discussed about this issue with Farin, our brother Salman, and other friends in Pakistan. But due
wow,
to some
sir.
issue, I that time I do not want to go Pakistan due to some other engagement. But my organization very associated with the Pakistan people.
Thank you, sir. We are very much excited and very happy to know more about your organization and your organization's office in Islamabad. So we are Pakistani people can get more benefit from Dhaka Sania Mission and your experienced staff and your chairman and other people. So thank you very much for sharing your knowledge. I hope we will visit your office in Islamabad maybe sometime. Thank you, sir. So we are request you once again. You already explained very well about the aftercare services and its challenges being faced by the services provider as well as the clients who are receiving aftercare services. But I would like to request you that what are the some misconception about aftercare programs and services. Can you please share your views? Yeah.
Misconception means some issue the parents, and also again I am telling the patients also, they feel we are offering aftercare services to earn money, and this is the misconception. But know the rehabilitation services, they are offering rehabilitation services, drug treatment services very cheap rate, very reasonable price, not like other clinic and hospitals, general hospitals. So our purpose is to help the people, our son, our brothers, to maintain the sobriety, maintain the drug-free life. So, so this is the major conception. They do not want to engage. Sometimes, again, I told earlier, the misconception, they feel that the drug treatment is a one-time issue. They don't know about the nature of the drug addiction. They don't know about the chronic nature of the drug addiction. It's a chronic issue, relapsing issue, and they need long-term nursing, long-term support, different type of support from the parents, from the family members, from the clients, and also the community people. So I told that they have no clear understanding about the aftercare services. That's why this is a challenging for rehabilitation center and service provider like us. So family education and community education also very important to give them awareness and to overcome the misconception.
Mhm. Yes, exactly, sir. It is very important to know the community as well as the families who are suffering by substance use disorder problems. That what are the programs of substance use treatment? They doesn't know about the treatment program, and even they don't know about the recovery as well. They are
Yes.
putting their patients in the rehab centers, and as you mentioned earlier that once they enter in the treatment center, they want a very clean boy and very healthy, and there could be no chances for relapse as well. So this is very misconception even found in Pakistan as well. So we at New Life Rehab Center Sialkot, by before admitting the clients, we are sharing a brief and very detailed about the treatment program, that this is not appendectomy diagnosed disease that should be very we just enter the patient, operate them, and send you back to maintain just their wound as well. It is a long term process, and family also can play a very important role, as well as the staff of the treatment centers as well. So last but not the least, I would like to request you, that is this is very related to our previous question, that what does the quality drug rehab programs looks like, because
Uh,
we already know you have a very huge experience, so we are and trying to get more and more knowledge, so that's why it might be a little different question, but
Yes, it's a good question, and this question frequently come to us also. The parents ask when we go to arrange any seminar, workshop, press conference. The parents ask the what how we find out the good rehabilitation center, how we find out some a good treatment center. This is really it's a good issue. Normally, we are told those maintain and then those practice, those rehabilitation and treatment center practice evidence-based services and validated program. Those are by through research that validate the usefulness of the program is very important. First one, like CBT, cognitive behavior therapy, contingency management, motivational interviewing. These are the validated technique, and those people, those center maintain the this type of offering this type of program. They can choose. And another issue, yeah, in recent some years we found mental health illness is increasing, and especially for the amphetamine user, the mental health program depression, so they need some psychiatric treatment, and sometimes the rehabilitation center avoid the psychiatric treatment, medical treatment. Now the rehabilitation center, rehab center and other center, they know the multidisciplinary team they need. So the parents can also find out the treatment center. Those are also providing rehabilitation service with the mental health support program and good psychosocial intervention they have. And also two point is very important, is a good infrastructure and capable staff and multidisciplinary staff. If rehabilitation center recruit and they have the multidisciplinary staff like physician, trained recovery, social worker, clinical psychologist or counselors, and also psychiatrists, they can find out this way the good rehabilitation center. But one issue, Saima, I want to share in Bangladesh, when the parents come to admit their child, they don't ask about the capacity of the organization. They don't just compare with the other center. They need to immediately they need to fix their problem. And after the admission, sometimes they feel very bad. This center is not good because there is not good treatment, not good accommodation, not good reception. But we normally told that before admit your children, you go there, you go our centers and visit them, and you see our accommodation facilities, our fooding facilities, and our staff capacity. Then you take decision. This way we normally provide parents information, and when they visit us, and if they have question about the treatment, and we normally very happy to provide this type of information and also answer that question, because it prevent the dropout and from the center. So I mentioned to the parents, you before admission to any rehabilitation center, you just visit them, you just ask them about the technical stuffs and what type of service they are providing. They have multidisciplinary team or a multidisciplinary program they have. If they feel that this is not appropriate for them, they can select another, therefore go to another rehabilitation center.
Thank you, sir. It's a very ideal treatment program. So I have another question. If you could please share your views that other than relapse, what kind of challenges a family or the person would face? Can you please share?
Yes. One issue I should mention here, family conflict, family unrest. Sometimes we saw mother coming to us to admit his boys, but children, but father not supporting. Sometimes we observe that sometimes fathers is coming to admit his boys, children, but mother not coming. This understanding need to be common understanding. Parents should take one decision. Family member should take one decision that will help client to for the treatment. Also, it is easy for the rehabilitation center. And frequently we face the wife admitting her husband, but parents come to us to drop out his boys. The internal conflict is big problem for the family members. So for the family members, you need to one voice and one decision that will help the betterment of your child and our client. And also they need some education. They need to understand the treatment nature and addiction nature, and they should participate in the family meeting, couple counseling, and others family intervention.
Thank you very much, sir. Very well explained about the aftercare services and its challenges very well. And on behalf of AISA Pakistan chapter and President Mr. Bashir Ahmed Naz, President AISA Pakistan chapter, and our colleague Mr. Muhammad Aslam, and all our professionals who joined us, we are very much thankful you for your precious time to join us and share your huge experience, knowledge with us, as well as not only your experience from Bangladesh, as well as we know you have international personality and having a lot of experience to work in substance use prevention, treatment, and aftercare programs as well. So thank you very much for your precious time once again.
Thank you, Saima, for your encouraging word. I feel very honored. And I think I'm just a worker. I am working for the people. I am not a big boss, but I am managing the people and working for the people. And thank you for the giving the opportunities to talk with the Pakistani brothers. And I'm really delighted to talk this night. And I am also inviting you in Dhaka to visit our center and our program, because so many Pakistani friends and brothers and sisters visited our center. Your Pakistani UNODC sends 2 batches Pakistani Rehabilitation Center program. Those are running the program rehab centers in our SIDA, our program in Bangladesh. So again, I would like to invite you to visit our center if our situation is going normal and we are free from COVID-19 coronavirus. Then we are most welcome to receive you and host you.
Thank you, sir. It is also really honored for us, and we already mentioned that you have a very busy schedule, and we are very lucky to have your precious time and getting benefit from your knowledge and experience. And we are also very much thankful for your invitation, like to invite us to visit your rehabilitation program. We are already very familiar to know about your work and your organization. Dhaka Asania Mission is very well known organization, and we are also learning already. So thank you once again for inviting us. And I would like our viewers would like to request our viewers that as you know that we have a limited time to conduct this live session, but we also very much appreciate you and thankful to you for your to join us. And maybe it because of the time issue and a limited time we can't answer all your questions, but if you want to know more about this topic, as it is already very well explained about aftercare services and its challenges, but if you want to know more about, you can leave your question here, and we would like to request Sir Iqbal Masood to answer your question in the comment box as well. So thank you on behalf of President ISA Pakistan chapter Mr. Bashir Ahmed Naz, and founder and advisor Youth Forum Pakistan Mr. Muhammad Aslam, and from all Pakistan we are very much thankful once again Sir Iqbal Masood to join us and share your knowledge and experience. Pakistan Zindabad. Thank you, and see you once again in other
Thank you.
session.
Thank
Yeah.
you. Thank you. Bye.
Thank you, sir. Thank you, sir.
Bye.
Take care.